not only alcohol consumption, but also with a poor diet high in sugar and unhealthy fats. When we think of liver disease, we often think of alcoholics with cirrhosis, but fatty liver disease is becoming increasingly common in non-drinkers as well. The liver is a vital organ responsible for filtering toxins from the blood, producing bile to aid in digestion, and storing energy in the form of glycogen. When the liver becomes overwhelmed with fat, it can lead to inflammation and scarring, ultimately impairing its ability to function properly. Non-alcoholic fatty liver disease, NAFLD, is a condition that affects millions of people worldwide. It is often referred to as the silent epidemic because it can progress silently for years without any noticeable symptoms. However, if left untreated, NAFLD can progress to a more serious condition known as non-alcoholic steatohepatitis, NASH, which can lead to liver cirrhosis, liver failure, and even liver cancer. The main risk factors for developing NAFLD include obesity, type 2 diabetes, high cholesterol, and high blood pressure. These conditions are often interrelated and can be exacerbated by a diet high in processed foods, sugary beverages, and trans fats. When we consume more calories than our bodies can burn, the excess energy is stored as fat in the liver, leading to the development of fatty liver disease. In addition to diet and lifestyle factors, genetics also play a role in the development of NAFLD. Some people may be more predisposed to storing fat in their liver due to genetic variations that affect how their bodies metabolize and store fat. This highlights the importance of personalized medicine in the treatment and prevention of fatty liver disease. Diagnosing NAFLD typically involves a combination of blood tests, imaging studies, and sometimes a liver biopsy. Blood tests can reveal elevated liver enzymes, which indicate liver inflammation and damage. Imaging studies such as ultrasound, CT scans, or MRI can show the presence of fat in the liver. A liver biopsy, although invasive, is the most accurate way to diagnose and stage the severity of NAFLD. Treatment for NAFLD focuses on lifestyle modifications such as weight loss, exercise, and dietary changes. Losing just 5 to 10% of body weight can significantly improve liver health and reduce the risk of disease progression. A diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce fat accumulation in the liver and improve overall health. In some cases, medications may be prescribed to help manage the symptoms of NAFLD and reduce the risk of complications. These medications may include insulin-sensitizing agents, cholesterol-lowering drugs, and antioxidants. However, it is important to note that there is no specific medication approved for the treatment of NAFLD, and more research is needed to develop effective therapies. Preventing NAFLD involves making healthy lifestyle choices, such as maintaining a healthy weight, exercising regularly, and eating a balanced diet. Limiting the intake of sugary beverages, processed foods, and saturated fats can help reduce the risk of developing fatty liver disease. It is also important to monitor blood sugar, cholesterol, and blood pressure levels regularly to identify and manage any underlying conditions that may contribute to NAFLD. In conclusion, fatty liver disease is a growing public health concern that affects millions of people worldwide. While alcohol consumption is a well-known risk factor for liver disease, non-alcoholic fatty liver disease is also on the rise due to the prevalence of obesity, diabetes, and unhealthy diets. By making healthy lifestyle choices and seeking early diagnosis and treatment, we can prevent the progression of fatty liver disease and protect our liver health for years to come.